Well, hi, I'm Bill Kiernan, and I'm the director of the Institute for Community Inclusion, which is a university center for excellence in disabilities located at UMass Boston and also at Children's Hospital in Boston. And over the last many years, I've been involved with a lot of efforts around expanding employment opportunities for people with disabilities. What's been interesting to me is a number of factors that are changing, and it may seem odd at this point to be talking about getting people with disabilities into employment when we have an unemployment rate that looks at 8 and 9% in many states. And it isn't odd. It's really important to think a little bit more broadly about employment over the longer haul in looking at our general workforce. Let me just first comment on the unemployment rate, since that's the figure that everybody sort of looks at. And an unemployment rate is really a pretty useless number. It doesn't tell you much about anything, because there's a lot of people who aren't necessarily working in jobs who get discouraged and they leave jobs, and they're not counted in that number. So basically you've got a number that doesn't tell us much. There's a much better number that I think we ought to look at, and that's the number of what we call workforce participation rates or labor force participation rates, and that's generally the number of persons who in the population are engaged in work. So if we had 100 people sitting out in the audience there, we would ask how many people are working, and they would raise their hand, and the number would probably be about 72 out of the 100. So that means that 28 people aren't working. They're doing something else, and the something else might be they're in school, although people would argue that's work. They might be at home raising children, which nobody would argue that's work. They would all agree it's total work. Or they may just have hit the lottery, or they may have retired and they're doing some fun things that they don't consider work, that are really meaningful to them or meaningful to others. So we've got a population of people who are really engaged in doing some things differently. Not everybody works. So the labor force participation rate is a much better measure. It tells us how many people are engaged in work. If we were to look at the employment of people with disabilities, and we look at the data, and we've collected data for the last 20 years on that, the data are really pretty grim. And in fact, in the last 8 years, they haven't advanced at all. We haven't seen any changes in the labor force participation rates. And what we really see for persons with significant disabilities, however you define it, and it can be defined a myriad of ways, but for significant disabilities, it's really the labor force participation rate is anywhere between 12 and 18%. So let's make it simple and say it's 20%. That means that 1 out of every 5 persons with disabilities are working. Now, why is that a big issue? It's a big issue because the major challenge for people with disabilities is poverty and isolation. And poverty is one of those things that we look at people with disabilities, and almost 40% of persons with intellectual disabilities live in households that are poor. They're at the poverty level. How do you get out of poverty? Earnings, money, your work. And so that's one of the important pieces about employment, is that it gives you some economic resources that you can go and buy things. You don't have to be poor. But the second thing, which is really important about the workplace, is that's where most of us now and for the last 2 decades have made our social networks. We make our friends out of the workplace. If you're never there, you really limit the opportunity to make friends and friendships. And so those are the 2 factors that I think are really important for persons with disabilities. One is it's a gateway out of poverty, and 2, it's a gateway into inclusion and membership. So now that we've established the idea that employment is an okay thing to do, the question becomes, so what are we going to do about it? And how are we going to change that number from 20% or 15%, 14%, or whatever it is, and it varies by different groups of people. How do we get it up to, and what should we get it to? And if you really believe that people with disabilities ought to have the same opportunities that everybody else does, then why don't we just take that labor force participation number and use that? So it's a little bit like a GPS. Many of us have GPSs, and the most essential element of a GPS is you got to be able to punch in a destination. You got to have a place to go. And if you don't have a place to go, it doesn't work for you. So let's take our place to go in employment of people with disabilities. If we agree it's important and it's a gateway out of poverty and it's a gateway to friendships in part, not the only way, but certainly a big one, that we take the labor force participation rate of 72.9% because we think that people with disabilities ought to have the same opportunities, that's the outcome. That's what we really want to look at. So now our target goal is that. And so the question is, how do we get to that target goal when we get a so-called unemployment rate of 8%? Two things. One is that unemployment rate is going to change because the demographics in the U.S. The older worker makes up a disproportionate size of the workforce, and they're going to step out and they're going to retire. And two things happen. One is it's going to put a demand on services because they're going to purchase services. And then the second one, which is equally interesting, is that the older worker who stays in the job over a longer period of time acquires things called health conditions, who, if we put them at age 30, we'd call them disabilities. You know, I didn't always wear glasses. And as my kids would always say, I remember it better than I do now, which is probably not true, but anyway, that sort of stuff. And so I acquire some limitations that in my workplace I make accommodations for. And those accommodations aren't terribly different than the accommodations you make for persons with disabilities who maybe don't see so well, don't hear so well, or have some memory issues like me. And so when you talk about it, the fix is relatively straightforward, and it fits the entire workforce. So as you sell that concept to industry, industry begins to see that in fact accommodating people with disabilities is good also for accommodating an older workforce that they desperately want to keep in some instances, not in all, but in some instances. And so you can see that the plan and the schedule is really set for a change in the labor rate and the workforce participation rate for persons with disabilities as our workforce ages, as employment opportunities become more rampant because the workforce shrinks, and the chance for us to better understand universal application of accommodations in the workplace for the workers of the future, which are the older workers, workers with disabilities, and the recently arriving immigrant workforce. So that's my take on employment for the future.
Well, thank you very much.